Hello everyone, welcome back to the lecture series on ENT disorders for nursing students. In today's session, we will discuss tonsillitis and adenoiditis, which are common infections of upper respiratory tract, especially in children. Tonsils are lymphoid tissues located in the oropharynx. They form part of the Older's ring and play important role in protecting the body from infections entering through nose and mouth. Tonsillitis. Inflammation of the palatine tonsils is called tonsillitis. It is located in oropharynx. Adenoiditis. Inflammation of the adenoid tissue is called adenoiditis, and adenoids are located in nasopharynx. It's mainly caused by infections like bacteria or viral infections, which leads to swelling, pain, and airway obstruction. Etiology. The most common reasons can be viral infections, and some viruses can be rhinoviruses, influenza viruses, adenoviruses, and Epstein-Barr viruses, and many other. Bacterial infections can be mainly due to Streptococcus pyogenes. And recurrent and frequent upper respiratory infections like pharyngitis, rhinitis, laryngitis can also lead to tonsillitis and adenoiditis. And in case if the person has low immunity, it can also lead to the condition. And if the person comes in close contact with the infected individuals, it can lead to the disease condition. Pathophysiology. The microorganisms enter the tonsils through food, water the person take, and the microorganisms can enter the adenoids through inhalation of the air. There, the microorganisms, after the entry into the tonsils and adenoids, they colonize, grow, multiply in the lymphoid tissue, which will be triggering the activation of the immune system and the inflammatory response in the body, which leads to swelling and enlargement of the tonsils and adenoids. And this swelling and enlargement of tonsils and adenoids can lead to swallowing obstruction, and in severe cases it can lead to airway obstruction. Gradually there will be pain, fever, and infection symptoms like breathing difficulties, swallowing difficulties, etc. Clinical features. Clinical features can be sore throat. Difficulty in swallowing can either termed as dysphagia, and fever. In case of infections, the very first symptom to occur is fever, malaise, which is weakness, and the tonsils will be swollen, red, and sometimes there can be pus formation, and the patient can breathe through mouth if there is any airway obstruction, nasal obstruction, and snoring, sleep disturbances is another symptom. And cervical lymph nodes will be enlarged, very particularly in the neck region. This is the normal tonsils, and this is the enlarged tonsils in case of infections. Adenoids. Adenoids are present just after or behind the nasal cavity. This is the nasal cavity, and the adenoids are present behind the nasal cavity. The inflammation of these adenoids is called adenoiditis. Diagnostic evaluation. Clinical assessment can be done. In the clinical assessment, we assess the patient if there is any sore throat, fever, dysphagia, are they breathing through mouth, any snoring, any obstruction or nasal obstruction, airway obstruction, and through examination we can see the enlarged tonsils or adenoids, and sometimes in the examination we can observe the presence of pus, redness, swelling. Throat and swab culture. So this is needed to identify the bacterial infections, very commonly streptococcal infections. And why do we need to do culture? If the bacteria is identified, the type of bacteria is identified, it is useful in choosing the appropriate antibiotics for the treatment. Rapid antigen detection test can be done to identify the group A streptococcus organisms, and this gives result within minutes. Complete blood count uh, can be done to know the severity of the infection. Generally, there will be increased white blood cell count in the blood in case of bacterial infection, and there can be lymphocytosis in case of viral infections. Lymphocytosis is the increase in the number or count of lymphocytes. The lymphocytes are a type of white blood cells. X-ray. Usually lateral neck X-ray can be taken, so where it can be done to know if there are enlarged adenoids, or in case if there is any obstruction in the airway, and this x-rays is really very useful in chronic cases. Nasal endoscopy is another procedure where an endoscopy is introduced into the nasal cavity, which has a camera at its tip, which helps in direct visualization of these adenoids, the size of the adenoids. If there is any enlargement in the adenoids, any pus formations can be viewed through this nasal endoscopy, and this is very accurate assessment when compared to that of this x-ray. Medical management. Analgesics can be given to reduce the pain. Examples can be paracetamol and ibuprofen. Antipyretics to treat fever. Example, paracetamol. Antibiotics are given to treat the bacterial infections, and penicillin can be the drug of choice. In case of any allergic reactions to the penicillin, then the infection can be treated with amoxicillin and azithromycin. So advise the patient to do warm saline gargles, and encourage them to take adequate amount of fluid and rest. The surgical management can be tonsillectomy, which means removal of the tonsils, adenoidectomy, which means removal of the adenoids. And why these procedures or surgical management can be done means in case of frequent infections, severe infections, if the patient is suffering breathing difficulty, airway obstruction, and if there is any sleep apnea means there will be pause in the breathing and resuming. So pausing then resuming, this can occur during the sleep. In case of the sleep apnea, the surgical management can be done, and in case of severe difficulty swallowing or breathing difficulties, so surgical management is advisable. Nursing management. So as a nurses, it's important for the patients with tonsillitis and adenoiditis to view the airway, breathing pattern, if they are breathing through nose, through mouth, so assess that, and check the vital signs, very particularly temperatures, and assess the level of pain, to what intensity they are facing the pain, and encourage them to take more fluids, uh, and provide them with soft and warm diet which will be easy to swallow. And oral hygiene, which is important to prevent the excessive growth of the microorganisms, and post-operative care can be done if there is any surgery done to the patient. Patient education can be mainly focused on giving them the awareness regarding the oral hygiene, and encourage them to take adequate fluids, proper nutritious diet, proper rest, and tell them to use the complete course of antibiotics as prescribed and avoid irritants or like dust or pollen or some foods like cold foods. Avoid advise them to avoid these cold foods. And in case of any breathing difficulties, in case of severe mouth breathing, then advise them to take the medical care, to visit the hospital immediately. Tonsillitis and adenoiditis are common infections of lymphoid tissue in the throat and nasopharynx. Exam tip: tonsillitis refers to inflammation of the palatine tonsils, whereas adenoiditis refers to inflammation of adenoid tissue. Recurrent infections may require surgical management such as tonsillectomy and adenoidectomy. Remember for exam, tonsillitis affects the palatine tonsils in oropharynx, while adenoiditis affects the adenoid tissue in the nasopharynx. Early diagnosis, appropriate treatment, and proper nursing care help in preventing complications and promote recovery. Thank you for listening.